So today in Queensland we have 589 new cases to report. We have just 3 people in hospital with mild to moderate symptoms. So we have no patients in Queensland with severe COVID-19. This brings the total number of cases of COVID seen in Queensland to date to 3,564, with 1,389 currently active. There have been 1,365 cases in Queensland diagnosed since the borders were opened last Monday, the 13th of December. And this excludes overseas acquired cases. What this shows us is that the vaccines are working. The vaccines are clearly working. But what I have a very important message, and I think this really needs to be made clear. In the coming weeks, we will be seeing large numbers of cases, thousands of cases. Even though the proportion of people getting severely ill with this disease was going to be very small, when you have large numbers of cases, that will translate to a significant number of people that has the potential to put a strain on our hospitals. So that is why the masks are so critical. There are 2 reasons why the masks and the other measures are so absolutely vital. One, to reduce the strain on the hospital that will occur. There will be some strains on the hospital in January simply because of the large numbers of cases in the community we are expecting. And 2, to give as many people as possible the opportunity to get that boosted dose, particularly those people that are vulnerable, the elderly, those with underlying immune disorders, etc. So clearly the vaccines are working. The numbers of sick people we are seeing, significantly sick people, are small, but because we expect large numbers of infections because of the very contagious nature of this Omicron variant, it is likely there will be significant numbers of admissions to hospital, and you can help by wearing those masks. And the masks perform 2 tasks, and they're equally important. They protect you, but they also protect other people from you, because if you're vaccinated particularly, you may be carrying the virus and you may not know it. And so you could potentially transmit it to someone else. So by wearing the mask, even if you feel well, you may be protecting other people. So I'll continue. There were 30,684 tests completed yesterday, and I thank everyone who came out to get tested, those who had symptoms. I understand there were some queues. We have 350 testing locations across Queensland, including both public and private providers. There were 11,315 vaccinations given yesterday, and again, I'm very pleased to say more than half of these were 3rd doses. So 85.65% of Queenslanders 16 years or older are now fully vaccinated, and 90.25% of Queenslanders have received at least 1 dose. Locations where we're now seeing cases, or we've seen cases in the last 24 hours, include Brisbane South, Brisbane North, Bundaberg, Cairns, Douglas Shire, Fraser Coast, Gladstone, Gold Coast, Goondiwindi, Gympie, Ipswich, Lockyer Valley, Logan, Mackay, Mareeba, Moreton Bay, Noosa, Redlands, Scenic Rim, Southern Downs, Toowoomba, Townsville, Western Downs and Whitsunday. This virus is everywhere. And so it is somewhat surprising that despite the fact that it is everywhere, we are seeing relatively few sick patients in hospital. And that's because the vaccines are working. But the numbers of people we're going to see with this virus in the next few weeks is going to grow very substantially. And even with that very small proportion of people getting sick, that will have an impact on the hospitals. We're moving steadily towards caring for more patients in their homes. We currently have 268 patients being looked after in their homes. There are 110 people in hospital, but as I've said, only 3 of those are really being treated for COVID symptoms, none severe. The rest is still in hospital for other reasons, but we are continuing to develop measures for getting people out of hospital for their care. Thank you very much.
Doctor, tomorrow is Christmas Day. Do you any advice on how to do Christmas safely, and can you still hug grandma?
I think a couple of things. If you can have activities outdoors, that's a great start. I would probably limit contact between individuals over the Christmas break. Hugging grandma, well, I'm going to hug my mother. I think I'm not going to say to stop that for Christmas Day. I think that would be probably going a little bit too far. Obviously, if you have any symptoms, if you are unwell, please don't attend Christmas events. And if you're not vaccinated, stay away from everybody. Don't go to any Christmas event if you're not vaccinated.